I'm Stacy Toach, and I'm from the University of Alabama at Birmingham, and I work in Robert Sorge's lab. And I was interested in how diet affects pain and recovery from injury. So we developed a standard American diet that was high in refined sugar, carbohydrates, trans fats, saturated fats, and an anti-inflammatory diet that had components that have known anti-inflammatory properties, such as broccoli and green tea and ginseng and curcumin. And we looked at these two diets in mice, and over the course of 15 weeks we looked at mechanical and thermal sensitivity and blood glucose levels, and then we induced a chronic pain injury, and we looked at recovery in those diets, and we found that the animals who consumed the standard American diet took twice as long to recover from an injury, and the animals that were on the anti-inflammatory diet actually recovered faster than the animals on the regular diet. We looked at two diets. We looked at a poor diet, the standard American diet, and that mimics what Americans eat. And then we looked at an anti-inflammatory diet to see if the anti-inflammatory components could reverse or prevent the negative consequences of the standard American diet. We looked at Von Frey and Hargreaves, so that's mechanical and thermal sensitivity, and we found that the animals that consumed the standard American diet, they had this more pronounced sensitivity to the mechanical and thermal tests. The animals on the regular diet took about 2 weeks to recover, whereas the animals on the standard American diet took double that time, and the animals on the anti-inflammatory diet recovered from this CFA injury much quicker than the regular animals. So the implication here is that this anti-inflammatory diet is actually preventing the consequences of the standard American diet, and perhaps could be used as an intervention for people who are undergoing a surgery who normally have a very poor diet. They could possibly change diets and have better outcome. We had a third condition looking at animals who had initially been on the standard American diet, and then we switched them to an anti-inflammatory diet at the time of injury. And those animals actually recovered faster than animals on the regular diet. So not only does coming off of the SAD diet lead to better outcome, but also having this anti-inflammatory diet. So the two together are better than the regular diet. The next thing I'm looking into is I like to call it the SAD weekend. I'm feeding different groups of animals, either the regular diet, the standard American diet, the anti-inflammatory diet, or I have them switched on the weekend to the standard American diet from either the AID or the SAD, and that's to mimic what we do, which is binge on the weekend. And so this should be a more practical way of looking and see if there are any effects short term like that.